Hello, my name is Erica, and I am the nurse for a 45-year-old male patient named JD. He does speak English and he is married, and the patient's wife is at bedside. So I would introduce myself, verify the patient, and make sure that it's okay to speak or give instruction while the wife is at the bedside. The patient was came to the ER with complaints of frequent urination, increased hunger and thirst. He said he just wasn't feeling himself. The wife became concerned because he was complaining of vision issues, headache, and was confused. His blood sugar was at 600 and his blood pressure was at 188/120. The only medications that the patient was currently on was Synthroid and Protonix. I would provide a little bit of information about the Synthroid and Protonix just to make sure that the patient is taking it correctly, since it would be on the MAR. I would advise them that Synthroid or levothyroxine, they could see either or. It's used to treat hypothyroidism, which just means that the thyroid doesn't produce enough thyroid hormone. I would make sure that the patient was taking the medication on an empty stomach and at least 30 to 60 minutes before breakfast. I would make sure that the patient wasn't cutting or crushing the medication, and not to double dose. If they miss the dose, wait until the next time that the dose is due, or if it's too close to take it unless it's too close to the next time. They would also need to follow up with their primary care provider to make sure that labs are being done, to make sure that the medication is effective. Also, the new medication that the patient is on is metformin, so I would advise the patient that levothyroxine can elevate blood sugars, so they need to pay close attention to their blood sugars and monitor those daily. Then for Protonix or pantoprazole, I would let the patient know that this helps reduce stomach acid. It helps with heartburn, acid reflux, indigestion. I would make sure that the patient wasn't taking any over-the-counter meds like St. John's wort. It can affect the effectiveness of the medication. Also, I would question the patient about his diet. With a blood sugar of 600 would also be a good indication that he's not following a good diet, but also high fat meals can decrease the effectiveness of the Protonix. Carbonated beverages, caffeine, citrus fruits, those all can also affect it. The patient would need to report to the provider if they have a headache, nausea, vomiting, diarrhea, abdominal pain. Those things would need to be reported immediately. The medication is also better absorbed with food, so they need to take it at the same time every day with a meal. The same as the levothyroxine, the patient cannot crush, chew, or break. The Protonix can also cause a decrease in magnesium levels. So if the patient was experiencing any cramps, seizure-like activity, irregular heartbeat, those things would all need to be reported to the provider. It's not meant for immediate relief, so this is something that needs to build up in the patient's system. They need to get into a routine, take it every day, and then they will see the effectiveness of it from there. One of the new medications was Lopressor, which is also with 50 milligrams PO daily. So that means 50 milligrams by mouth daily. So that's just once a day. Lopressor is also called metoprolol, which is a beta blocker. Beta blockers are used to lower blood pressure. They also affect the heart rate. So when taking these medications, it increases your chance of dizziness and falls. So the patient needs to rise slowly when standing. If they have any fainting, they need to report that to their provider immediately. They need to check their blood pressure and their heart rate regularly. Normal instruction that we give is to take the medication give it an hour and a half for 2 hours for the medication to kick in, and then take their blood pressure, and keep a log of that. This needs to be done for at least a month. If they're not seeing any change, then of course report this to the provider. If they're not feeling well, it needs to be reported to the provider, but it needs to be taken at the same time every day, and then the blood pressure needs to be taken at the same time every day to determine the effectiveness of it. So with this medication, it may prevent signs and symptoms of low blood sugar, like fast heart rate. So they also need to monitor their blood sugars to make sure that it's not disguising the symptoms. They need to be careful with over-the-counter meds. This medication is given for blood pressure, and over-the-counter meds can cause your blood pressure to rise. A lot of the medications say have heart on it with HBP, but it's always okay to just check with your nurse or your provider before taking any of these. If you have any chest pain, severe dizziness, passing out, abnormal heart rate, slow heart rate, between 60 and 90 is what's considered normal. Shortness of breath, a big weight gain in just 1 day or 2, swelling in the arms or legs, those things need to be reported immediately and probably taken to the ER. You can take this with or after a meal. And that is all on metoprolol. And again, that's metoprolol or Lopressor, 50 milligrams once a day. Okay, and then he also was prescribed lisinopril, which is also a blood pressure medication. So you'd be on metoprolol and lisinopril. So it's very important that you're monitoring your blood pressures correctly, so we can make sure that it's not too much. So with lisinopril, you want to be sure that you're not just jumping into high activity actions or sports or driving long distance before you know how the medication affects you. Anything that you need to be highly alert for, just be cautious of this. Again, rise slowly, check your blood sugar, check your blood pressure. Be careful in hot weather. If you lose too much sweat or fluid, you're vomiting, any of those things can cause your blood pressure to drop, and we don't want your blood pressure to drop on top of taking lisinopril and metoprolol, and then that be dangerous for you. So anytime you're sick, have diarrhea, anything like that, you want to make sure you're monitoring those blood pressures, and if they do get too low, then just report it to your nurse or go to your ER. A common symptom with lisinopril is a cough. It's like a dry hacking cough. If that does develop over the next couple of weeks, then just let us know, and we can the provider can make adjustments to your medication. You'll want to take this with food, just like the metoprolol, same time every day. Take your medication, wait an hour or 2 hours, hour and a half. Take your blood pressure, write it down, and then at your next follow-up, we will review those and make sure that the medication is doing what we want it to do. And with your blood sugars of 600, you were diagnosed with type 2 diabetes. And with this medication, he started you on metformin, which is kind of a beginner's medication, or where we like to start. We start at a low dose at 500 milligrams. And again, it's PO, which means by mouth, once a day. A lot of times this is increased after we see if you can tolerate it. So this does help control your blood sugars. You need to take it with meals to prevent your blood sugar from getting too low. Side effects, a very common one is diarrhea. We kind of expect that, so just try, if it's not anything too bad, we hope that once you build a tolerance to the medication that it will go away. But anything like dizziness, headache, agitation, nausea, vomiting, diarrhea, nausea or vomiting, report this to us. Metoprolol may cause your blood sugar to drop. So we need to really make sure that we're monitoring your blood sugars with this medication, monitoring your blood pressure and your blood sugars. Alcohol consumption can also cause a really big issue. It's called lactic acidosis, and this could be very dangerous for you. So you want to avoid alcohol consumption, or discuss with your provider how much is too much. Signs and symptoms of low blood sugar would be excessive sweating, weakness, dizziness, anxiety, tremors, hunger. We want to watch out for those with the hypoglycemia. Taking the medication on with a meal, just making sure that you're monitoring these, your blood sugars is going to help prevent that. So we want to make sure that you're following a regimen, taking it at the same time every day. Take it as prescribed. Follow a diabetic diet. Regular exercise, 30 minutes a day, 3 to 5 times a day, 3 to 5 times a week. Watch your feet. Make sure that there's nothing going on with your feet, no open sores, nothing like that. Monitor your blood sugars. Avoid over-the-counter drugs. And make sure that we will give you a card, and make sure that you're carrying a diabetic ID card. So if you were ever injured, they know that you're diabetic. This is very important. Do you have any questions?